Not everybody has a little bit of ADHD. Here's what ADHD actually is: diagnostic criteria, resources on how to get tested and get diagnosed, and how to respond to people who kind of dismiss you when they say, oh, everybody has a little bit of ADHD. Just because you're distracted does not mean you have ADHD. My name's Dr. Heidi. I'm a physician and I have ADHD. For starters, I'm pulling straight from the DSM-5, which is basically the guidebook for all diagnosis in medicine. There's two main subtypes of ADHD: inattentive or hyperactive and impulsive, and you can have a combination of both. These symptoms are present with at least 6 or more in each category for at least 6 months, and you have to have a majority of these symptoms that were present before age 12. With inattentive, they don't appear to be listening, trouble following through or following directions, difficulty organizing, reluctant to engage in activities that require sustained mental attention, easily distracted by external stimuli, even noises, senses, forgetful in daily activities. Not me losing my phone while I was on the phone with somebody. And then the hyperactive type will be moving, climbing, jumping in places that are inappropriate, unable to have leisurely time. This can be one of the reasons why ADHD people gravitate toward things like drinking so much. We have higher rates of addiction tendencies. I think a big part of this is because it allows us to wind down, because otherwise we're feeling like we're on the go and driven by a motor constantly. Trouble waiting in line, interrupting or intruding, or thinking you know what somebody else is going to say and cutting them off mid-conversation. These symptoms are present in 2 or more settings, like home, school, work, with friends. Other people are noticing this all the time. And the reason I advocate so much for comprehensive testing is because they do not occur where they're explained by another mental disorder that needs to be treated first. You can have mild, moderate, or severe, so they exist on a spectrum. If this sounds like you can take a look at the adult self-report scale that's present online. And your doctor might offer you a test like the Connor screen. Or for children, they can offer things like Vanderbilt or Wechsler scale. There's plenty more that you can choose from. All of this are part of a comprehensive testing evaluation. It can be really helpful in getting people access to a testing accommodations. If you're looking for more resources, whether you're a child or an adult, take a look at the CHADD website, CHADD. They can help you find providers in your area, get connected with different resources, and follow me if you like learning more about your ADHD brain. So the next time somebody tells you everybody has a little bit of ADHD, you can give them a list of the different ways in which this affects you personally and professionally or academically.